Hi friends, Jim Robeson, the Medicare Answer Guy here. Thanks for watching this short video. As many of you know that starting in 2025, there are going to be major changes to your prescription drug plan. Whether you have a standalone prescription drug plan or a drug plan that's part of your Medicare Advantage health plan. What are those changes? Well, some of them are good and some of them not so good. The good part is starting in 2025, you won't pay more than $2,000 a year. Now, this is especially important if you have a brand drug where all of a sudden your cost went through the roof and you started paying hundreds and hundreds of dollars. So that's number one. Number two, the dreaded donut hole is gone away. So two great benefits starting in 2025. Now, the not so good part is because the Inflation Reduction Act has caused insurance companies to take on more of the cost to lower, to lower your drug cost, they've cut the broker out. And so this is a problem from a contract standpoint, where if I'm not licensed with an insurance company, especially the ones that are very competitive, then there's a liability issue. And so this is why I've put together for my clients and those that watch the video, this tutorial video to show you exactly what I've done for years and years and years for my clients. And so starting this year in open enrollment, I can't do that. So I'm putting together this video. It's very simple, straightforward. So let's take a look. So here we are at Medicare.gov, right up here in the left-hand corner. And what you want to do is to come down to where it says log in or create an account. And you want to click that. Now, if you have not created an account, meaning if you haven't registered your red, white, and blue card, this is where you need to do this the very first thing. So click this create an account, put in your information here. It takes about 5 or 10 minutes. Save the information. You're going to create a username and a password. And once you do that, then you come back to the login. Now I've got my information here, so we'll use that. So you put in your username and your password. You come down here, you log in. Now, the very first thing that they're going to ask you to do is to pull out your phone, and they will send you a text to verify your identity. So let me put that in. Now, this changes every time you log in. All right, so we're going to log in. So abracadabra, here I am. Here is all my information. This is when I started Medicare. This is my current prescription drug plan. My Med Sup plan is with United Healthcare. So I go up here to where it says my name. I click this, and I want to make sure that all of the meds that I'm taking are in the system. So my saved drugs, it's retrieving the information. Now, I don't take a Ozempic, but we'll put that in just for comparison purposes. So as long as you have all your meds in there, if you don't see your meds, then you can click this add another drug. And once you've added all of your medicines, then you come down here, you're done adding. And now you want to start a new plan search. So you click that button. So here we have my prescription drug plan is with WellCare. What we want to do is we want to find other plans for 2025, including mine if I continue to renew it. So you come over here, find plans now. You'll click that. We're looking for 2025 plans in my zip code. We're looking for prescription drug plans. We see that if I did not change my WellCare value script, my premium is going to go from 40 cents to $17.40. My total drug costs are going to skyrocket. My deductible has gone up. But what is the next competitive plan? Well, according to this, it's Cigna Healthcare Saver for $20.60. So I want to compare my plan by clicking this button here, add to compare. I also want to compare it against the Cigna plan. And here's the third plan or a second plan to compare that's competitive. Now, there are other plans down here, and probably, well, they are more expensive than the top three. So once you click the plans that you want to compare, you click the compare button in the bottom right, and now you have my plan versus Cigna and AARP. Now you can see a big difference here. AARP is $115 a month, Cigna is $20.60, and my WellCare is $17.40. All three of the drugs are covered by each of the plans. So let's take Cigna Healthcare and click Plan Details because we want to see how this plan works. This is Cigna Healthcare Saver. They are, we'll show what the star ratings are later. It's $20.60. The deductible went up from last year. It's $590. All of my meds are shown here. It shows what pharmacies are preferred and what are not. Why do you want a preferred pharmacy? Because it can lower your costs. That's very important. And you can see here that depending on what pharmacy I go to, I'm going to pay a certain amount. So the lowest cost would be, of course, with the preferred with Cigna, whether it's Walgreens, Rite Aid, or mail order. And if you come down even further, it shows the estimated total drug cost and the premium cost. Now, if we continue down, here's what's changed. Remember, I said the biggest change and benefit for you and me is that we won't pay more than $2,000 a year. So if you come down here, it shows you the estimated total monthly drug cost. And you can see at some point, in this case, starting in August, you're not paying anything for your drugs. That's when you hit the $2,000 limit. If we continue to come down, you want to click this blue banner, View More Drug Coverage. It'll tell you, depending on what tier drug it is, if you come all the way down, you can see that these two meds here, amlodipine and lisinopril, are tier 1. So I'm going to pay $0 if I go to a preferred pharmacy. I'll pay a little bit more if I go to a standard. But Ozempic is a tier 3. So on this plan, and many plans that have a deductible, you're going to pay through your deductible first, or I am, and then I'm going to pay 17% of the cost of the drug. What does that look like? Well, if you come back up here, it looks like that in January, let's say I go to Rite Aid, I'm going to pay $644.10. Then it's going to drop to $160 level until I get to August, when CMS and the drug companies realize that I've already paid $2,000 out of pocket, which includes your deductible. All right, let's go back up here because a very important part. The other thing that's new in 2025, you see these costs right here? $640.10, $160. What they've done, what they've told insurance companies, offer a Medicare right here in the middle prescription payment plan where you can pay that money instead of paying $644. You can level all of those costs out across the board, 12 months at a time. So those are some of the changes. Let's go back up here. Let's say I don't want to be with WellCare. I want to go with Cigna Healthcare because it's a little bit less expensive. Let's go back and take a look. How much less expensive? Well, if I stay with WellCare Preferred, I'm going to spend total $2,200. Or with Cigna, it's 1900. So let's say that I want to go with Cigna. You come back here, see this little blue button here? You click enroll. You want to join the plan. You put in your Medicare information. It takes about 10 minutes. You follow the bouncing ball, you click, and you enroll. And your new drug plan, starting January 1st, 2025, that's when it will become effective. It will automatically cancel your existing drug plan, and you've got a new drug plan. Now, this is really important that you do this every single year. Why? Because they're going to continue to cut the cost. The broker probably won't be available. So I hope this video was helpful for you, and I hope to see you next time.